Hi there, welcome back to my channel. My name's Catherine, and if this is your first time here, I have breast cancer and I'm documenting my treatment journey. Today is Friday, so I went in for my blood work, which is routine to make sure that everything is what it should be before I go in for my next chemo treatment. And then I met with the oncologist, and unfortunately, we have to postpone my chemo treatment, which was scheduled for Monday. My white blood cell count was too low for them to be able to proceed with doing chemo on Monday. So we're postponing by a week. That would put my third chemo treatment happening on April 19th now instead of Monday, April 12th. So this might actually explain a lot for me why I was feeling as bad as I was this time. Like round 2 hit me really, really hard, and even my good week, I've been incredibly tired. I've had headaches every single day. So the fact that my white blood cell count was as low as it is might explain or, give some kind of reason to why it was hitting me so hard. The other thing we discussed is my doctor is thinking that the next chemo round, she might take the dosage from like 100% and bring it down to 90% because different people tolerate the medication differently, and perhaps I am not bouncing back or tolerating the full dose, which is based on my height, my weight. I'm not tolerating it as well as they would like me to, so her plan is to take it down to a 90% dosage and see if perhaps that works out better for me and that I bounce back more efficiently. So at first I was a little nervous about that because I'm like, this is triple negative breast cancer, and that is one of the most aggressive breast cancers there, and why not go at it to the full force that we can? If I feel crappy for a week or two, then isn't that worth it, kind of thing. She said basically anything above 85% for the dosage is pretty much equivalent to 100%. So that's kind of their gap to work within in order to make the treatment as efficient as well as painless as possible for the patient. So that's what we're going to do. We're going to take a week off, hope my white blood cell count bounces back. I'll go in for blood work next Friday, so a week from today, and then proceed to my third treatment of AC chemo on April 19th, and hopefully it won't be as hard on me as the second treatment has been. That's the plan moving forward. So I'm hoping that I get to actually feel good this week, because my good week was not as good as it should have been with all the headaches and just feeling completely run down. So here's hoping, fingers crossed, that I can have a really nice week coming up. So I'll check back in later and see how that's going. It's Sunday now. I've had this week as another down week since my chemo was postponed due to low blood cell count. My previous blood work. I had blood work done again this Friday that just passed, and all is well, so I'm good to go and do my third chemo treatment tomorrow. This week, this extra week off, what I've noticed is that like wounds and bruises and stuff that I've had for weeks now since my last chemo treatment actually started to heal. So I had this huge bruise on my arm here where they tried to put in an IV, and that bruise just stayed basically the same level of bruising for over 2 weeks. And it was only this week really that it started to fade, and now you can't even see it, it's gone. Same with another spot that they tried to put an IV in. It was raised and a bump was there, and it just didn't look like it was going away. And again, this week it started to go away. And so it was confirmed with the blood work that my white blood cells are high enough to be able to proceed with chemo. So my body's actually trying to heal all of the cuts and bruises that I have on my body. So I felt confident that when I did the blood work on Friday that I would be moving forward for my 3rd chemo treatment tomorrow. And that's what's happening. This week has been fairly good. I haven't had the amount of headaches that I had the previous weeks, but I still get tired. It's a different level of tired than when, the week after I have chemo, but it's still, I feel tired a lot. New side effects, I guess, of chemo that I've noticed as well is dry skin. I've had for weeks now where my hands have felt really dry and kind of like cracked, so it just feels like I have all these like micro cuts all over my hand. And if anything rubs against my hands, I feel like it's starting to create a blister a lot quicker than it should. But the new thing is my face is super, super dry. I'm moisturizing frequently. I'm going to be switching over to a moisturizer that is specifically for dry skin to see if that helps, but it's like flaky, tight, dry skin, and it doesn't feel good. But I'm trying to exfoliate, I'm trying to moisturize, but it's just kind of, goes with the chemo, I guess, dry skin. So what else has been happening? Fatigue has been ongoing, as I said, this week. Even though I'm like 3 weeks out from my last chemo treatment, I'm still getting tired. Also find as well that I'm having like a slower time processing things, like in my mind. Sometimes I forget words. I don't know if that's just because I'm tired or if that's, the starting or part of chemo brain or whatever, but sometimes I just forget words and have to be like, that thing that does this. So that's fun. And then the other thing that is new this week, well, I guess it's maybe been a week and a half or so, is hot flashes. Back in my fertility time, near the beginning of my fertility treatments, we tried a drug called Clomid, which one of the side effects of Clomid was hot flashes, and those would be like super intense. 1 minute you're fine, and the next you're like, whoa, and just sweating. So this is like a mini version of that, I would say, mostly happening at night, so like night sweats, and I can feel like just like a flush of warmth throughout my body. So my night tends to be a lot of kick the covers off, pull the covers on, kick the covers off, pull the covers on. I do get it during the day sometimes as well, and I can feel it coming on, and it lasts maybe like a minute or two. Might get a little sweaty or glistening, as women do. So that's different this last couple weeks. With chemotherapy, there is a chance that it will put you into like a chemo menopause. At my age, there's a potential that it will permanently put me into menopause. We'll have to see how it goes. But yeah, little mini hot flashes throughout the day is a new part of my life due to chemotherapy. So that's kind of the new stuff that's been happening in the last couple weeks. I have had 3 weeks off from chemo. Well, I had chemo, there's that week, then I had two down weeks. So we'll see how this next round of chemo goes. Last week I met with a genetic counselor. My oncologist had referred me to genetic counseling, and you have to fill out this survey basically of your family history, your medical history, and based on that they determine then if you will move on to actually speak with a genetic counselor. This form was an online questionnaire where it was asking about my family history, other members of my family going back to like grandparents, parents, uncles and aunts, my sisters. I don't have any brothers, but my sisters, their children. That's kind of the scope of the family tree that they were assessing. So I had to specify, which members of my family have had cancer, what type of cancer, what age they were when they had that cancer, Other questions pertaining to, my grandfather passed away as a result of colon cancer, so then my aunts and uncles, have any of them had cancer, which they haven't, but have any of them had polyps, etc., on their colonoscopies, which they all do because my grandfather passed away from colon cancer, as well as anyone else in my family tree that has any form of cancer, or if they died of a stroke, if they had other diseases, that kind of thing. So then they take all of that information, including my diagnosis of a 41-year-old with triple negative breast cancer, multicentric triple negative breast cancer, and then determine whether I qualify to meet with a genetic counselor. Low risk is defined as a family having occurrences of cancer over the age of 50. They're common cancers like breast cancer, prostate cancer. So those aren't really indicative of a hereditary link between the people in the family who have had cancer. Now, moderate risk of cancer is there's groupings of more than 3 occurrences of what would be considered common hereditary cancers. For example, like a breast, ovarian, or colon and uterine. Those are considered groupings for hereditary cancer. So if you have, like I said, more than 3 that have these groupings, or if you're having a diagnosis at a younger age, like I did, as well as if there's any specific ancestry ties that are known to have high occurrences of hereditary, which is I can't say the word, but it's a type of Jewish ancestry that it's very common for certain types of cancer. So that would be an automatic moderate risk factor right there. High risks are having many generations affected with hereditary types of cancer. Like I said, again, breast cancer, colon cancer, ovarian, uterine cancer. So having generations on the same side of the family with those types of cancer, as well as having diagnosis at young ages, or having multiple types of cancer in one person. So if they had like breast cancer as well as then having uterine cancer or something like that, that all then equals out to a high risk for a hereditary cancer link. So those are the 3 types of risk levels that they look at. Now, when I did my meeting with the genetic counselor, it was kind of like a group meeting at first where they just went over some, basics and some administration stuff. And then I had a one-on-one with a genetic counselor. My one-on-one with the genetic counselor, she told me that based on my diagnosis, the fact that I am young and it's triple negative, which apparently has a higher rate of linking to hereditary, we're going to move forward with genetic testing for me. So what that entailed was a blood test. Simple as that. So I had my blood taken, and they are going to be running a gene panel test on it. So they're going to test, I think it's something like 19 or so different genes, known genes that mutations are often found when looking for hereditary links. So the fact that I am in the starting phases of my treatment, so I am in chemotherapy right now but haven't done surgery, they actually put a rush on my genetic testing. So instead of 8 to 12 weeks for results, I should be getting results in about 4 weeks. And that's with the idea that if something comes back with a positive gene mutation, my surgeon, having that information, it might change our surgical plan. Right now, I'm trying not to think too much about what surgery is going to be required. I'm prepared myself that it's going to be a mastectomy, but knowing if there is a gene mutation that puts me at a higher risk for reoccurrence, might alter the plan to, potentially a double mastectomy as a preventative, even though my left breast is currently unaffected. It's just more information that will help us make a better and more informed decision moving forward once we get into surgery. So I'm actually lucky that the genetic counseling came so quickly and can actually be factored into my treatment plan at this time. So I'll come back with the results and let you guys know once those come in, to see whether I have any positive hereditary gene mutations. What this also means as well is if I have these mutations, it's something that like my mom and my sisters, like my family, can know about, so they could potentially, if they choose, look to see whether they also have a mutation. And at the very least, it can be a stronger motivation to make sure that they're getting maybe checked early. Neither of my sisters are old enough to, start the routine mammogram schedule, but maybe knowing that, our family potentially has this mutation, that then they can try and do that sooner rather than waiting until they're into their 50s and stuff. So we will now sit and wait for the results and see what happens with that. But it's definitely an interesting side to this process. So that's the update for the last couple weeks that have gone by, and tomorrow I'll start again and have my third chemo treatment. But hoping with the change of dosage, it will maybe be a little bit more manageable than the previous treatment. But time will tell. Thanks for watching. Don't forget, if you want to follow along with my journey, please like and subscribe and hit that bell so you get notified when my next video comes up. I hope you guys are having a wonderful day, and thanks again for watching.